button.
Yep,
And
I see it says recording now.
okay, great. God, you're very technical here.
Well, no,
So
it's in the
anyhow,
upper left corner. It says recording.
oh, okay. Yeah. Anyhow, well, I'm so glad you were able to join me to do this. And I just, like I said, I had a few questions. It's maybe, 5-7 minutes talking about the project that you worked on, the Curbside Nevada. And I guess one of my first questions was, how did you guys come about it? You said there was 400 doctors in the East Coast that started something like that?
Right. There's a national effort that's being done by 400 psychiatrists, primarily based off of the East Coast, because that's really where the demand was. But they're taking phone calls from physicians anywhere in the United States who are being overwhelmed by the COVID experience. What we wanted to do in Nevada with only 200 psychiatrists was to have a call-in service where 10 hours a day, any healthcare provider, whether you're a physician, a pharmacist, a nurse, a social worker, respiratory therapist, if you feel like you're over your head, you call us and we'd like to talk with you. We're not trying to diagnose anyone. We're not trying to treat anyone. We're trying to be a resource. And the other thing we're making available is consultation service. So when our colleagues are treating perhaps one of our mentally ill individuals who now got COVID, they may have questions specifically about the medications that psychiatrists have been writing. Is it okay to mix this with that? And we're finding out that, if you remember when the whole thing about hydroxychloroquine came out, you had to be very careful about the heart, that there was a problem where you could actually cause the heart to fail. Well, some psychiatric medications can do that as well. So what we don't want to see happen is put things together that increase the likelihood of the heart misbehaving.
Mm-hmm. So would that also mean, for example, you have patients that come in or they have patients that come in and they're depressed because they're, because of their situation? Or is this more like long-term people who've been on anti-anxiety medication for the last 20 years? Or?
Well, the focus of Curbside Nevada has been to address immediate needs when someone with COVID shows up in the hospital quite medically ill. And we know that the whole experience of being medically ill raises the likelihood of being depressed. Also, being put on a ventilator raises the likelihood of having delirium because people are being medicated, they're being unnaturally restrained, they're actually breathing in the opposite way that you would normally breathe. And so the whole experience is quite traumatic. And there's a whole body of literature now that's describing what it's like to spend a week on a ventilator, probably get minimal sleep, but be drugged the whole time. And we had hoped people wouldn't remember any of this. Unfortunately, some people are remembering this and they're having sort of a traumatic delirium where they come out of the experience and are not well off.
So these are people who have recovered, right? I mean,
yes, the ones who survive the ventilator experience are winding up with what can become the beginning of a post-traumatic stress disorder because they've had this horrific nightmare experience, and we had to do that to keep them alive. But we hoped that they were totally sedated through the whole experience, but they weren't. They're not completely unconscious to the point where they have no memory, and they often are having terrifying dreams and nightmares where while it's happening, they think they're being tortured, and now they're recalling that afterwards.
So when we're reading all the statistics every minute, every hour that say so many are infected, so many have died. So the ones who are infected that haven't died, is this kind of the experience a lot of them having? They're coming through and can you explain that a little bit? So is this, I guess what I'm trying to ask, is this people who have gone through this experience that you're mentioning, the intubation, and now they're coming out of it? Is that a lot of people?
Well, it's been thousands of people. If you look at just the East Coast, the epicenter being New York City and greater New Jersey, Connecticut, and New York, where they've had thousands of patients over the last 2.5 months wind up on ventilators. But to be ventilated, they had to be intubated. So in a very unnatural way, we hope we give enough sedation to make people unconscious, because nobody could tolerate having a tube push down their throat and obscuring their airway without some kind of sedation. That's what we do in operating rooms every day if you're an anesthesiologist. but that's not the usual experience of most people, especially when it's an emergency situation and they have to intubate rapidly. There have been shortages of medications that are needed to do the intubation. So my understanding is part of the trauma, the psychological trauma, has come from maybe not adequately preparing the patients, emergently doing things, putting them on a ventilator, tying them literally to the bed so they can't move and remove the tube from their throat, perhaps giving them paralyzing medications so they physiologically can't move, and then expecting them to breathe in this incredibly unnatural way. We don't understand the mechanics of how we normally breathe. We just do it. But when you're on a ventilator, it's the exact opposite of how you breathe when air is pushed into your lungs and then allowed to passively come back out.
Hmm. Wow, that sounds like an incredible ordeal. So these people come out of these hospital situations, and then do you help them find psychiatric care, post hospital here in Nevada?
At this point, we have not been able to address, as far as I know, my colleagues doing Curbside Nevada, we have not yet been involved with post-delirium care. What we're dealing with in real time would be the caregivers, the doctors, the nurses, the respiratory therapists, providing services to people who may be ventilated, who may be on the precipice of ventilation, and then all of the trauma that for the doctors, the nurses, the respiratory therapist is happening from all hands on deck. Everybody's in emergency mode. Everybody's working long hours. They're hardly getting any time off. Some have been recruited from other areas in medicine to actually help in the ICU. A physician assistant I spoke with came from one area that had nothing to do with critical care medicine, but was pulled into the ICU because they just needed medical people to be available. So the calls we're getting, I think, have a lot to do with the overwhelming environment for the healthcare providers. And then in the long run, there's going to be problems for some of the patients. We haven't gotten there yet.
Hmm. Wow. So these doctors, from what I understand, doctors in general don't necessarily always like asking for help. Do they find that you're being a doctor, you and your colleagues, does that help them reach out more?
I think it makes it more collegial. That's why we call this Curbside Nevada. There's a tradition in medicine that you can get what's called a hallway consult. You're walking down the hallway, you see someone from another discipline in medicine, you can ask them a question or two, and they'll sometimes give you some advice. So we wanted this just to be colleague upon colleague and not to try and make this a medical consultation for any individual. We're telling people up front, we're not here to diagnose pathology. We're not going to medicate you. We're not going to refer you to a hospital. We promise we're not sending anyone to the emergency room for an assessment. We want to be able to do this collegially.
Hmm. Hmm. So what kinds of questions do you get, or what kinds of topics? Do you listen and they talk, or?
Yeah, one of the kind of the two major themes would be people are saying, I feel overwhelmed. What do you think I could do to maybe cope a little bit better? So you could ask questions about, are you getting enough sleep? Do you get any time off? When you come home, how do you relax? What do you do to relax? The advice we would want to give would be have a proper meal, perhaps put on some quiet music, maybe take a nice leisurely bath or a long shower. What I don't want to talk about with people is how much alcohol to consume, because that's not going to really help. Maybe a little bit of wine or a half of a beer with a meal is one thing, but when people tell me they're drinking a bottle of something, that's too much. The other kinds of questions that I've received had to do with, what medications may I use for a patient who's having this particular problem? Is there anything I need to watch out for in terms of compatibility with my other medicines that I need to prescribe because of the severe respiratory problem from COVID virus? So we're trying to balance what's safe to mix together, give some practical ideas, help come up with safer combinations when we can think of ideas like that.
Mhm. Wow, that just sounds like it's a very stressful thing. And then we heard, what was it, a week ago or 2 weeks ago about the doctor in Manhattan who died by suicide because she was so overwhelmed. Do you foresee that being a trend?
Unfortunately, I do foresee that some of my colleagues may become so overwhelmed that they might commit suicide. And what was interesting about that is she didn't actually commit suicide in the middle of the crisis that she was living in. She took a break, got away from it, went to another state, and then took her life. So that really troubles me because a lot of warning signs must have been missed, or people just wanted to hope for the best. And I get it. We all like to hope for the best. However, I think most medical people are trained to plan for the worst.
Hmm. So is it becoming a trend in hospitals to have support groups or, lunch hours or something to help the medical staff there?
You know, that's a great idea. There's a concept called lunch and learn where you get like a bag lunch and a little bit of information to make you just a little bit smarter. So far, I've not seen anything that resembles group therapy, lunch and learns. But what I have noticed is most hospitals are communicating to the staff, if you're feeling overwhelmed, here are resources for you. And it's more than the usual couple sessions of what used to be called EAP, Employee Assistant Program. It seems to be a little bit more comprehensive. And I think there's a reality for the hospital administrators. There's only so far you can really push your medical staff, your nursing staff, your custodial staff. I mean, we're down to everybody matters, and we can't have anyone who's expendable.
Mhm. So one last question here. I look back at other times in history where we've had a lot of stress, say the Vietnam War. You had all these soldiers come back, and that's already been what, 3 decades, 4 decades? Anyhow, they're back, they're here. It's, half a century later, they're still suffering from PTSD. They still have, problems with alcohol or drugs. Not everyone, but there's enough of them. It's become a big issue. Do you foresee that happening, looking to the future, that you're going to have a generation of mental health workers and doctors that have gone through this experience that are just never going to get over it?
Yes, that was the basic reason why we set up Curbside Nevada a couple of months ago. We started thinking about this. A couple of us have been thinking, but particularly I've been thinking because I did my master's thesis at UNLV on the idea of mental health support for critical incident responders. And
Mhm.
we are in a mass critical incident. It's not just the healthcare providers that are being overstressed. I think society, all of society is being overstressed right now. We're expecting people to cram into their houses and their apartments and go nowhere. We're saying stay away from people, don't go to church, don't play golf, don't play tennis, don't go to the grocery store. Think about the kids, don't go to school. Well, I mean, for most of my grandkids, school's the most important thing in their life, except for the athletic program after school. They're not even allowed to play baseball anymore. So many of the things that we think of about being an American, you just can't do that anymore. And it's not just America. This is a worldwide problem. It's stressful for everyone, as far as I know. Everywhere I can read an article, everybody's distressed right now.
Mhm.